Morning. It is my honor to welcome you to the annual meeting of the members of the American Foreign Service Protective Association. I want to thank those of you who were able to join us in person this morning in particular. Some of you may remember that we used to hold this meeting in January, and we moved it to March because of the weather. Some of you may also remember that last year we had to cancel the meeting because of the weather. We did have 5 or 6 brave souls who showed up in person. But I want to thank those of you who came out this morning, despite the cold, the sleet, the snow, what was on the ground, and so forth. I also want to say a special welcome to those of you who are joining us online. This is our second year offering a live broadcast of the meeting to those members who cannot be here in person. For anybody who can't stay for the whole meeting, either online or in person, we will be recording the entire session, and sometime next week we'll have that recording up on our website so that you can refer back to the information. A couple housekeeping items for those of you who are here in person. Some things we have to note. In the event of an emergency, the nearest exit is through this back door, straight out into the main hallway. Please continue past the elevators, and then you can split in both directions. There are stairwells that take you downstairs. There will be staff to lead you out and to a safe rally location. That is in the unlikely event. Should you need the restroom, perhaps a more likely event, follow it out straight down the hall, past the elevators, turn left, and you'll find the ladies and the men's restroom on your right down that hallway. They should be unlocked. If you run into any trouble with the door being locked, please ask at the reception desk and someone can let you in. This morning we will be giving a report on the past year, 2018. You'll also have an opportunity to hear from CEO Paula Jacob. After that report, she'll be doing a mini presentation on Medicare and how it works with the FEHB. To kick things off, in just a moment, we'll be hearing from our chairman, Tom Tracy. But before we do, I want to recognize 2 other board members who were able to join us this morning. They're both over here, so if you don't like the job that I'm doing, you know who to talk to. That's Dave Witten and Sarah Horsey. Thank you all for being here. Many of you were able to attend the health fair beforehand. Paul will give some more details about that in just a few minutes. But you will have opportunities to speak with him throughout the day. My name's Kyle Longton. I'm COO. I'm wearing this blue badge. Anybody who has this blue badge is a staff member. Please feel free to ask us any questions you have. We'll be happy to direct you where we can. But for now, without further ado, I'd like to introduce our chairman, Mr. Tom Tracy.
I'm really impressed, actually, with the snow and ice that was out there this morning. Our change of time didn't seem to completely solve the problem, but we'll keep at it. I wanted to start out this morning by saying today is actually a very big day for us. It is the 90th anniversary of the founding to the day of the Protective Association. It was March 1st, 1929. And in those days, the federal government's fringe benefits were ranged somewhere from slight to non-existent. And we were founded to provide annuities and group health and group life insurance because those things were not provided. Later on, in the early 1940s, we were the first federal employee organization to set up group health insurance. This was with Mutual of Omaha. This was 20 years before the FEHB plans, which came in July of 1960. Having said that, the challenges that we face today in the delivery of health care are complex and growing, and I'm sure I don't need to tell you that. There's an awful lot of trends in the healthcare industry that are going on sort of relentlessly. Independent doctors' practices are being purchased by hospitals. Hospitals are being purchased by chains. The insurance companies and the health providers are consolidating at an extremely rapid rate. The federal government changes in regulations usually are not terribly helpful. But in any event, these changes are being brought about because of the tremendous complexities of delivering health care today. And much as we may regret the complexity, a lot of it is necessary, and it's driven in part by the specialization of medicine. And talk a second about cancer. One of the things that Paula, when she goes through the slides, will show you is a service that the association is offering for the treatment of serious diseases. It's called clinical consultants. I use cancer as an example because it's the most serious, I suppose, certainly the most prevalent. The treatment of cancer today, cancer is probably 1,000 diseases or more, and there are variations even within the same types. With the emergence of immunotherapy, the DNA of both the patient and the cancer become crucial to the delivery of the right chemotherapy and, in some cases, immunotherapy, which can produce miracles but is extremely narrowly focused. It only fits with certain kinds of DNA. So one of the services that is being offered is advice on which DNA tests you might take to develop cancer, and also which places that you might go for consulting on this. This is not to knock the day-to-day clinicians, but the changes in the cancer treatment are happening so fast, it's very difficult for them to keep up. The association is, and you will see this when Paula goes through her slides, the association is trying very hard to give you the tools to help you through this maze. We can't control the maze very much. We're a small organization, and a lot of the complexities are driven by the market and by other factors, some of which are very genuine and correct. But what we're trying to do is take the initiative to give you tools in which you can help you get through this maze. So, at our 90th anniversary, I would say the challenges look at least as big as they did in 1929. And again, I want to thank you for coming out and appreciate it very much.
Thank you, Mr. Tracy. On our 90th anniversary, we're also going to hear about some other ways in which we're at the forefront of meeting the needs of our members, both here in the U.S. and around the world. You'll hear about some of those from Paula in our year in review, and I'd like to invite her up now. So Paula Jacob, CEO and Executive Vice President of the American Foreign Service Protective.
Good morning, everybody, on this nice sunny spring day. How many of you remember when we had this in January? Oh, well. Okay. But we're here, and we're going to have a wonderful time talking about insurance. So, happy anniversary to AFSPA. We are very, very pleased that today, March 1st, in a room in the Department of State, 4 men created the American Foreign Service Protective Association. It was quite a day for them. The discussion was held by the Foreign Service officers at a new concept in providing retirement annuities for Foreign Service officers, that's what they were called, and followed shortly thereafter by group life insurance, which was unheard of at that time. So this is from the minutes of that meeting, which I have in my office on little onion paper. It is the desire of the Protective Association to make available for its members every benefit it is possible to obtain for the protection of the officers in the Foreign Service. That could be deemed our very first mission statement. So 90 years later, we have the same concept here. We have the same name. How many companies can you say after 90 years has the same name? And I think that we have the same mission. So we are very, very proud of that. None of us were around in 1929, but we keep the torch going. So that's our history. It's kind of ironic that last year we were notified that we were one of the finalists in the Moxie Awards. Now, I had no idea what the Moxie Awards were, but I guess it's a pretty big deal. And the Moxie Awards recognizes DC area businesses for their, are you ready for this? Boldness and innovation as an integral part of their growth strategy. So we were recognized along with all of these up-and-coming tech companies and software companies and all that stuff that, thank goodness I have IT people because I don't understand. But we were very proud of that, that this company that's been around for 90 years was recognized along with these brand new up-and-coming leaders. We're very
Congratulations.
So now to the boring stuff. The Affordable Care Act is alive and well. Actually, it's alive and on life support, but it still exists. And the individual mandate requirement still exists. Please, come here. I don't bite, I promise. Only my staff.
I noticed they have sharp nails.
They do. So you will receive, if you haven't already received from your health plan, the 1095B form. I understand that ours were mailed out the end of last week. So if you haven't received them yet, you will receive them. All right. The agencies will send out a 1095C form to active employees and any employee who retired in 2018. If you retired beyond that, before that, you will not receive anything from your agency. So you do not need to have this to file your taxes. You can file your taxes, but like all of your charitable contributions, you keep them in a file. I recommend that you keep them in a file when you get that. This is the last year for the 1095 requirement unless Congress takes an action to do something about the individual mandate. So we'll see, but as of today, this is the very last year you will receive a 1095 because it was for last year's tax year. A little bit about the Foreign Service Benefit Plan. Our numbers are open season numbers. We actually processed over 2,500 transactions in this office in the last several weeks. We were blessed enough to have 1,500 new enrollees and only 575 terminations. Now our total enrollment, meaning the actual enrollee, tops over 33,000. A far cry from the 18,000 we used to have. Our total membership as of January 31st is over 82,000 members that every day are that their lives are in our hands as far as their health care. That is quite a growth. So we're really, really proud of that and pleased. Some of the statistics from last year with the Foreign Service Benefit Plan, we paid over $317 million in claims. This is the very first year that we topped 1 million individual claims. And over half of those, 67%, were sent to us electronically through the member portal. It's very, very, very handy for both domestic and overseas. Our operational results, we had a 98.23% claims processing accuracy. And in spite of everything, I know you find this hard to believe, especially those who suffer through migration, we had 85.92% of our claims were processed within 15 days. Not so much in January and February and March, I admit, but we got better as the quality checks improved and everything. So through the entire year, though, we had 85% of our claims being processed within 15 days, which is about half the time of what OPM requires. So while I know that it was painful and I acknowledge that you didn't get the service that you're used to and you deserved last year, I thank you very much for your patience and your loyalty as we work through the new system. Performance results, this office received over 150,000 calls. Nay, I have over here. Over 150,000 calls. That was a 31% increase over 2017. Our written correspondence was over 138,000, including almost 35,000 emails, which is almost a 50% increase over 2017. So you waited a little longer for the emails, and I wanted to address that as well. The reason that we got the 48% increase, I think some of the reasons, you sent an email to us wanting to know the status because your claims weren't processed in the normal 7-8 day time frame, right? And then when you didn't get a response from us, you sent another email. So we still maintain that we want to look at every single email. Even though some of them were duplicates, we couldn't be sure that some of them were duplicates, so we looked through every single email to make sure that we didn't miss anything. So that is why it's not an excuse. I know it shouldn't have happened, but it's the reason why it took so long, and we are still catching up with that. Let's talk about prescription medication now. We had a total of 870,000 medications per individual prescriptions filled, and over half of them were through the mail, which was good because that's where your bigger discounts come. We paid almost $69 million in just prescriptions alone on this health plan, and the plan itself paid over 88% of your prescription charges, which is the highest in the federal program. OPM is constantly dinging us about why we are paying so much towards the members' prescriptions, and as long as we can, we will continue to try to absorb as much as we possibly can toward your prescription costs. Wow. Yay. Yay. So, some of the questions that I received, and I've tried to keep the membership notified of what was happening in the arena with, as Mr. Tracy talked about, the consolidation of healthcare. The first one I want to address is the Aetna CVS consolidation. There will be limited immediate change for us. The same team serves us. Where is Britt? There she is. She's our manager. Thank you very much for everything you do for us. We have two complementary companies coming together and giving us all of their strength. Now, what I'm most excited about this is CVS. The locations will function as a community-based health hub, meaning it's going to be easier for the members to get health care because it's going to be in their community. Will it happen tomorrow? No. But it will happen, and we are very excited about it. Already looking at how am I going to put this benefit structure in place. So I'm already bugging Britt about, here's what we can do. Calm down, Paula. 2020, 2021, let's get everything off the ground. But Express Scripts will continue to serve as our pharmacy benefit manager. Right, so that will not change. The new concept, and I'll just go through this very briefly, is the strategy is providing the clinical services in the same store that you go to do your shopping. Makes sense because they already have the mini clinics. This is just an expansion on that, and their focus is targeting these chronic conditions. So because that's what you need the support for. So the initial concept is the stores will focus on chronic disease. This is a little bit about what they think the design is going to be. You know that's going to change about 100 times. But this is what they think it's going to be. Now the next one is the ESI Cigna merger. I just said I have a shell now for the mergers, and all I do is just plug the names in when I report. All pharmacy operations will remain the same. Now remember, neither Express Scripts nor Cigna have bricks and mortar, right? They they provide health care and to the individual. So Express Scripts has for many years been building technological capabilities around the individual members. And their strength actually lies in bringing health care to the member, which is a goal that we share. So that is what will be happening with them. So this is one of their slides, and it is a pretty generic slide. It doesn't really apply to us. It applies to the big guys. But we're going to get the advantages of all this. So when I sit back and think about all of these mergers and consolidation going on, I don't think about, oh my gosh, what's going to happen to us. I think about, oh my gosh, what's going to happen to us. Imagine the possibilities now. Here we are sitting in the middle when we have 4, now 2, of arguably the largest and most influential healthcare companies working for our members on our behalf. So we're going to have these member engagement tools that we have been pushing so hard on. Community-based health hubs, the convenient in-store screenings. So you can just go to your pharmacy because there's a real clinic there to get those screenings. Prescription services for both the domestic and the overseas population, and all of these enhanced tools and analytics. And they are working, every one of those people are working for every one of you. So instead of sitting back and worrying about it, I'm really very excited about this. I think it's going to be just great, eventually, once we get over that first hump of what do we want to be and where do we want to go. So there's all kinds of ideas rolling around in my head about it, what it can be. It's very dangerous in my head. Okay. So, yes. Question?
I'm sorry to interrupt at this point, but since you said CVS, it just reminded me. I was surprised when I went for my prescription a couple of weeks ago and realized that CVS was no longer the provider, and it's Rite Aid / Walgreens. So does that mean we will be able to return to the CVS pharmacy network?
We have always been in the CVS pharmacy network. See, the thing is that Express Scripts and CVS already have a contract. CVS is one of the pharmacies. They are not a 90-day, they are not a smart 90 pharmacy yet.
I called Express Scripts and they
So when, after the presentation, you can talk to one of my people. And actually, we have Mirzad here from Express Scripts. All right?
Yeah,
Okay, thank you.
Yeah, absolutely.
Okay, so the FEHB program for 2019, what do you expect? What should all of the members expect, regardless of what health plan you have? OPM has made it clear, very, very clear, that they expect all of the plans to give us online support tools so that you can become more engaged with your health care. And member-specific information, not the stuff that you can pull off of Google. Information that is specifically for you to improve your engagement. They want us to provide health and programs and strategies, including strategies for those very serious conditions. And they want us to provide a map for you to take care of, to engage in your own health and to keep you healthy. And that means wellness incentives, or as I call it, paying you for it. Prescription drugs remains a big deal. They want a lot of medication management and utilization management, but they also want you to be able to go to the plan's website, no matter what plan you have, and find out how much your prescriptions are going to cost you. No surprises, regardless of whether you're getting it at mail order or whether you plan on picking it up at a pharmacy. They want, and we do have those tools that Mirzad will be demoing in just a few minutes. They also want us to address the opioid epidemic. This is a big deal. Now, it may not be a big deal for any of us in this room. Here, please come sit down. I promise I won't bite. I promise. Okay. So you'll see a lot of these pain management programs And I had to sit back and wonder, why is this such a big deal? I mean, we're Americans. Why is this opioid epidemic such a big deal? What happened? How did we get here? Well, let's talk about how we got here. In 1995, the American Pain Society launches its 5 digital signs. Remember this chart now? They say, you know, smiley, and on a scale of 1 to 10, what is your pain level? That started in 1995. Coincidentally, the FDA approved OxyContin in 1995. I think that's where it all began. In 2000, the Joint Commission releases a report that says the doctors are under-treating pain. Let the party begin. You got, you know, that's when they started liberally prescribing opioids. Oh, you've got a toothache, let me give you 30 days of OxyContin, right? 2010 to 2014, things start, wait a minute, what are we doing here? And so the president actually urged judicious opioid prescribing in public awareness terms. That's when they start thinking, is this really the right thing to do? Is it really a good idea to give so much drug and then have it sitting on the counter or in your medicine chest that your teenage child can get it? Right? So now people are starting to pay attention. So that's a little bit of history. I could go on all day about what the details of that. So that's really a little bit of history. So OPM says, wait a minute, we want all the plans to figure this out and to help the membership, the subscribers, with pain management. If we can prevent the addiction, if we can take care of the pain without opioids, or help you through, because opioids are good. They're a reason why you take them. You don't want to come out of a major surgery with a hip or knee operation without pain medicine, right? So, but it's how you do it and how long you do it. So, the FEHB response on opioid misuse is all of this pre-admission counseling. So you're going to get a phone call from one of our nurses even before you hit the hospital in many cases about, you know you're going to come out with a prescription. Let's talk about what you do with that prescription. True story, we had a guy who came out of the hospital, and his wife 2 weeks after surgery was giving him the OxyContin every 4 hours.
Wow.
So the counselor called. This is a true story. The counselor called and said, "So how's it going?" "Oh yeah, well I'm giving him the medicine every 4 hours." They said, "Well, have you tried to drop it down to every 6 hours, or maybe put in some Tylenol or something in between that?" "Well, no, because the bottle says every 4 hours."
Oh my God. Oh my God.
Thus the coaching. No, not necessarily, because doctors sometimes forget to counsel. They're getting better. All right, so this is the type of things that the plans are expected to do. So we have done this for a couple of years, and we want to try to take this concept of the holistic view, the individual person, and focus on personal support in everything that we do, not just pain management or opioid control. Intervention at the right time, the right support programs that are specifically for the individual patient. And that is what the Foreign Service Benefit Plan tries to do every single day, with the support and the cooperation and the resources of all of those wonderful partners we have now. That many of them are out there in the room just waiting for you to come talk to them about what they can do. So our theme for the next year or two is getting you involved in your health, because your health matters. It matters to us and it matters to you. So our theme now is commitment to the member engagement, to your engagement. Migration, a lot of challenges, but it finally produced a lot of opportunities and a lot of resources that we didn't have before with the old system. So the member engagement platform is brand new. You have tools out there that you couldn't imagine. I'm really excited about this partnership with the new groups like the Pinnacle Care that Mr. Tracy talked about. That you can talk to my people out there about what they can really do for you, and many, many ways for you to get engaged in your own health. And we want you to have the tools at your beck and call with just a push of a button, because your health matters to us. So where do you start? Well, you know what I'm going to say. You need to start with your HRA, right? Your health risk assessment. And that way you get your personalized summary, and then that will help you choose the programs that are going to best suit your needs. And then you're going to go to the biometric screening, which measures your cholesterol levels and things like that, and it will help you determine, are you really healthy? Or do you just think you're healthy? Be different sometimes. And then you can earn incentives by doing healthy actions. Now we changed this. I am not going to go through this. Don't worry. There is pamphlet out there, and we have staff ready to talk your ear off about our Living Well Together program. But what we've done a little bit is we've tweaked it to provide you with the tools that you need to address those specific conditions that can really affect not just your health, but your lifestyle. So please feel free. I encourage you to talk to the staff there about our Living Well Together program. Many of us have chronic conditions. I would probably say most of us have chronic conditions. You know, we're all Americans, and we do. So what support do you need to get you where you want to be? That is our challenge, is providing you with that support. So we do have specific programs. Our In Touch Care program provides you with a lot of nurse support, social worker support, pain management support, one-on-one coaching programs, digital programs, and they're all out there just waiting to talk to you. Interactive tools that you can look up things if you have a question about a specific condition. They'll be demoing that in just a few minutes, as soon as they can get me off the stage. And pharmacy support. And this is kind of something that I don't think people realize how much support Express Scripts can give us. As a member, as a patient, you can get a personal medication coach. We have specialist pharmacists that are well-versed in things like heart, diabetes, cancer, that you can actually talk to a pharmacist about your condition. A Credo Specialty Pharmacy for those people who need that to have those high biotech drugs. And again, the medication comparison. And Mirzad will be demoing many of that soon.
Yes.
So those are really good support programs for your chronic conditions. 3 of the engagement tools that we're very proud of that you'll get a demonstration very shortly is our member portal to get you started, the Aetna Navigator, and all of the tools and resources that are at your fingertips with the Aetna Navigator, and of course the Express Scripts website where she'll demo all of those tools that are at your fingertips. So that will be coming on. The portal, your single sign-on, this is where you submit your claims. Yancy, you'll be demoing that. Navigator is where you can get a copy of your EOB and check the status of your claims. And Express Scripts, of course, is where you can get your prescriptions filled. Even the app on the phone. That's how I fill my prescriptions all the time. It's very quick. I want to give you, before I turn it over, is some examples of the types of support that the Foreign Service Benefit Plan offers. Telehealth, you probably heard about it in the news, this big thing is coming up. This is the way medicine is going to be carried out in the future. Fewer and fewer people want to make an appointment, wait to go to the doctor, fight the traffic, especially when they're feeling rotten, right? They just want to pick up the phone or go on video and talk to a doctor. This is different than the nurse line. This is an actual physician's appointment. And I have this on my phone. It's terrific. I encourage you to look at it. Our staff will be more than happy to talk to you about our telehealth program.
And then
It's very good.
is it built, just a clarification, if I were to call one of those people.
Through the telehealth program?
Right.
Yes.
Then is that, do they send a bill?
To us. It's free to you.
And,
It's free to you.
and if you have Medicare
Yeah.
Part B?
I was with my primary who has that telehealth already inside.
So that would be your choice between whether you want to do the telehealth with the primary or with us, and they'll be able to answer those questions.
What's your Medicare? Do they bill Medicare first, or?
No, this is just for us.
Okay.
So we will, again, I'll get through this, and then I'll be happy to talk afterwards. Another program, this is a really cool program, guys. This is the Livongo program. This is the remote diabetes and remote blood pressure monitoring. That you get the monitor and your free, and all your test strips free for an entire year. And they are constantly monitoring you and helping you and supporting you through this. We have this service because and it's not Bluetooth, it's cellular. We have this service in different countries that that our members are in and can actually use this. We mail it to them and they love it because it is their own personal dietitian. It's their own personal professional looking after them. And imagine if you have kids, a young kid in school who has diabetes, just imagine the comfort level of the parent knowing that somebody is constantly watching little Johnny. So if his blood sugar goes down, they know it immediately. So it's really good. I have a rep from Livongo there who will be happy to talk to you and demonstrate the advantages of this Livongo program, which again is free to membership. It's part of our benefit structure. Mr. Tracy talked a little bit about this new support program that's through Pinnacle Care. This is for serious diagnosis. It's not if you sprain your finger, but it is for the serious diagnosis that you go into the doctor and he says, I'm sorry, but I am sorry to inform you that you've been diagnosed with MS or with cancer. And all of a sudden, the hearing stops, right? Your brain goes away, and there's about 100 things that you need to know. You have no idea what you're going to do next. And you try to go online and you've got about 1 million different things. Is it true? Well, you call our case managers, and if and depending on the condition, we get you to Pinnacle Care. They will tell you what the best hospital is, the best physicians for your specific condition. They'll look at your records. And if you need to go to Dana-Farber or Sloan Kettering, no, you're not having to wait 3 or 4 months. They'll get you in next month or next week, whatever. Really neat. So this is another program that is available to our members of the Foreign Service Benefit Plan as just a benefit free of charge to you. Some of the interactive tools that we have is the health decision support tool. So if you have a question on a certain condition, just go online. You'll be demoing that as well. So there's lots of different things. So benefits and programs that we have. I've talked about all of the in-touch care programs with the pain management, the social worker. I've talked about the medical services and supplies. Adult hearing aids that you may not know that you have, foot or orthotics, Quest Diagnostics outpatient lab. Especially if you don't have Medicare Part B, you've got a co-insurance, right? But if you go to Quest Diagnostics, we pay at 100%. How about that? It's voluntary, you don't have to, but it's kind of neat to know, right? Our alternative benefits are very rich. Chiropractic, acupuncture, and Did I mention we have massage therapy?
Yes,
Did I mention that we're the only health plan that has massage therapy? Okay, no, we're not getting rid of that, don't worry.
Blue Cross Blue
Yeah,
Shield
we'll hang
has
on to that one. But you may not be aware of some of what I call the special programs, the diabetic education. You know, we have a whole cancer support program out there with the managers, the nurses that are available to really help you through that. And this is something, we have a therapies cuisine program. And this is specifically for people with cancer. The last thing you want to do is eat. But you got it, right? You've got to. And this program helps you through that really hard time of trying to get your nutrition when you're so sick because you're taking chemo. So that's a benefit that is, once again, free to you.
When did that come about?
It's about 10 years ago.
Oh, really?
Yeah, I think we put that in.
Wow.
So this is through Express Scripts. Happy to talk to you about it out there in the mini healthcare. So our ancillary insurance programs, this is not part of the Foreign Service Benefit Plan. We've grown a little since 1929, don't you think? These are all different programs, and our staff is willing to talk to you out there. Couple ones that I really want to talk about is our new, this happened last year, our discount care programs. These are not insurance programs. These are discount programs for dental and vision and LASIK. Some people just don't like dental insurance. They don't want to pay for dental insurance. They may have good teeth. They just want that comfort level to know that they've got something if they need it. Thus the discount program. But the main one I want to talk about is the True Hearing Benefit. How many of you have used that True Hearing Benefit? You okay? Kyle's used the True Hearing Benefit. 30 to 60% below national average, 3,800 different providers nationwide. And if you're enrolled in the Foreign Service Benefit Plan, because we have a pretty rich hearing aid benefit in the plan, you can use it in combination with that, with the True Hearing Benefit. So this is a little bit of just a few of the testimonials.
And we improved that benefit in 2019.
And we improved that benefit in 2019. So, and the staff will be happy to talk to you about that as well. People really love this program because it's, once again, free to the membership.
Both are in your packet, information.
Yeah, it's in the pack. It's in the packet. Thank you. So a couple more things, just briefly. For those of you who have supported the Senior Living Foundation, you know who you are. Thank you, thank you, thank you very much. It is because of your generosity that we are able to do what we do every day. I do want to acknowledge one person here. Kate O'Barry, could you please stand up? Kate is our social worker. Kate is our angel. Every client that we have gets to talk to Kate. And Kate is the one that makes sure that every client that we have gets what they need from the Senior Living Foundation. So Kate, thank you very much for being here. Last year we received $640,000, about $920,000, over $600,000 in bequests, $600,000 from one person. He believed so deeply in the mission of the foundation that he gave us $600,000. And then also $50,000 from DACOR and from Express Scripts. We were able to give away to these clients $264,000 in just last year, in 2018. We were able to guide them through the maze of local resources thanks to Kate. And we gave away emergency grants and one-time grants and ongoing grants, monthly grants, people who rely on our check every single month just to get them through the next month. And we were able to work with another person that I want to acknowledge. Sonia, where are you? Will you please stand? It's you.
Yay!
Helen is the executive director of RET at State Department. We work very closely with her counselors, retirement, to identify people who need our help. So thank you very much for your support of the Senior Living Foundation. Last year we gave Planning for Change. It's an every other year biennial seminar. It's an afternoon that is spent talking about mental health in seniors. This is what was the topic last year. Healthy lifestyle, care management panel that of course was chaired by Kate. Retiree resources that was chaired by Sonia, thank you very much. And estate planning. The video of that is on our website, and these are just a few pictures of everything that we did. So thank you very much for allowing the foundation to be part of your colleague's life. Because without you, we couldn't do what we do. So I've got some of the questions that most people had. I will not be able to get to all of them because of time. The rest of the session will be a little bit of tidbits, just things that you should know, some questions and answers. And then I'm going to release people who are not interested in Medicare to go out to the mini health fair and talk to the reps out there. And I will do a short Medicare and the Foreign Service Benefit Plan session for those who are interested in Medicare, and then the rest of us can go out and have some anniversary cake and talk to the reps and have some anniversary cake. Oh, I forgot, I mentioned that already. Okay, so a couple of tidbits that I thought might be interesting, just a few. There's some there, and I was out of the room, so I don't know whether Mirzad talked about that. But the Smart 90 retail pharmacies. Now, right now, for the last several years, we did not have the Smart 90-day supply at a retail pharmacy available because I couldn't get the discounts. So you would be paying double the price as you would sending it to mail order. We worked with Express Scripts, negotiated with them, and Walgreens gave us the discounts, which is why we are able to do the 90-day supply at a Walgreens, because that way you get the same payment, you pay the same copay as you would at mail order. So that is why it's at a Walgreens. We are looking at the demographics now and looking at the future with CVS, and we are looking at possibly offering CVS as a 90-day Smart 90 provider in the next year or two. But if we can't get the discounts, you're going to be paying double, and you don't want to do that. You'll just get mad at me, and I don't want that. So, but that is why it's just Walgreens. That doesn't mean that you can't go to a CVS or a Shafali's or a Rite Aid and get your 30-day supply, as you always have been. But the reason that we have the 90-day supply at retail is just like mail order. And it took a while to get you the discounts, but we did. The next thing is Medicare claims and chiropractic claims. Medicare does pay for chiropractic in a very limited thing, very limited, which is why before we can pay, if you have Medicare Part B, before we can pay for your chiropractic claim, you have to send it to Medicare, because Medicare has to tell us whether they've paid it or whether you've maxed out. Right. Massage therapy claims not so much, because big surprise here, Medicare doesn't pay for massage therapy, right? Yeah. So you can send your massage therapy claims to us right away, because we don't need the Medicare information. But we also don't need the CPT code.
What is that?
So the CPT code is that 5-digit code that the providers put on the claim. We don't need that. It is a straight out $60 benefit. We just need the massage therapy bill with all of the information. We do need the license number and tax number. Yes. But massage therapy claims do not have to go to Medicare first, because Medicare doesn't pay anything for that. All right, and the last thing I want to talk about is the HIPAA 3 form. HIPAA is a privacy, as you know. It's the Health Insurance Portability and Accountability Act. That's what it stands for. And we are very limited in the information we can provide and to whom we can provide that information, which is why your diagnosis doesn't show up on your explanation of benefits. Just why that little note says if you want that information, you need to call your physician for that. We also cannot provide information about your specific claim to anybody else but you, unless you give us permission to do so. Doesn't matter whether you've been married to the person for 50 years. Doesn't matter. Unless we have what we call a HIPAA 3 form that allows us to discuss your information with your designated appointee, whether it be your spouse, your child, your sister, whomever. Those forms are out on the AFSPA table. So if you want us to be able to discuss the status of your claims with your wife or your husband, we're happy to do that as long as we have the form. But we can't do that. It's not that we're being difficult. We just can't do that. It's against the law. So we printed out a bunch of the HIPAA 3 forms. They're right out there. Feel free to take one, and then we'll be able to put it in our system. I have about 10 questions here that, and that's about all we have time for. I will try to get through as many of them as possible. And these came both from you who are attending in person and for the people who are attending via webinar. So I tried to pull as many as I possibly could. One of them was, is there serious discussion in policy circles of, at some point in the fairly near future, making Medicare Plan B compulsory for those in the FEHB system as a cost-cutting measure? I have seen the idea floated in a couple of recent articles. This is not a new idea. It has been around for about 15 years now. Because TRICARE requires people to have their members to have Medicare Part A and B. The FEHB does not. So on the Medicare front, you may have heard about the Postal Service requiring this in their new Postal Reform Act. This is a big deal a year and a half ago. That because of the pre-funding obligations of the Postal Service, the only agency, the only service that requires all benefits to be pre-funded. Private sector doesn't even do that, but the Postal Service does, which is why they're hemorrhaging for many reasons, right? But this is a problem for them. So there was the Postal Reform Act that you may have heard of, and if that does go through, it will start a brand new design under the FEHB program for postal employees and retirees only, and they will be required to have Medicare Part A and B. That is not happening with the rest of us. And the reason it is because the OMB, the Office of Budget and Management, will not allow that because it is basically agency shifting, right? From FEHB to CMS. So I do not see that happening in the near future. There has been bills on the Hill for probably 15 years on that, and none of them have gone anywhere. That being said, however, in contrast, there is some talk out, and primarily by Senator Bernie Sanders, for Medicare for All, and you may have heard about that. If that goes through, I highly doubt it will, but if it does go through, then that will be the end of the FEHB. So that is what I see happening with Medicare and the FEHB program. I think you guys are just fine for a long time. Next question. Vision and dental care are essential to one's health. The extra cost to have basic annual checkup is too much, especially for the retiree. We appeal for a change in this coverage to cover at least one vision and dental checkup per year. I absolutely agree. Unfortunately, our boss, not you, OPM, we are not, according per OPM, we are not able to add any new dental or vision package benefits to our package. Even if I wanted to, which I would, we cannot. They will not accept that because They feel that these benefits, these wonderful health benefits that you have are for catastrophic and comprehensive. They are not for dental and vision, but they do give you the opportunity to buy dental and vision insurance under the Federal Employees Dental and Vision Insurance Program. Believe me, guys, I wish we could. We have very small dental benefits in the program. You can't spend it all in one place. I think it's what, $23 per cleaning or something.
Yeah.
And honest to goodness, we have not been able to change our. I think they came in 86, 80. I know, and we've been around for a long time, so it's been that long. And I couldn't even increase that benefit. They will not allow any changes. But we're the only plan that provides orthodontic. We got that in 85. So we can't change that either. So the answer is no. Sorry. Why does the explanation of benefits not clearly have the provider, the condition and the diagnosis?
If I may.
Yes.
For retirees, though, who are looking for an affordable dental or vision option, we point you to a discount program.
Okay.
Which is
that's
about
fine.
$15 a month, and we've got information outside
It's in
or
our
on our
packet.
website.
In a packet
Thank you,
too.
Kyle. Okay. And I think that we explained that, or Britt explained that there are certain, I know the explanation of benefits, it's hard to read. If you remember, how many of you were with us when we had Mutual of Omaha? Remember those days? And then we went to Coventry, and didn't we hate that, the explanation of benefits? But we got used to them, right? Right, okay? I promise you, you'll get used to these. Change is hard. I know that change is hard. I would love to be able to put everything that you ever wanted to know in your explanation of benefits, and then you probably complain because it's too long. But if you want the diagnosis, we can't do it because of HIPAA. You can call the physician. We printed instructions on how to read your explanation of benefits, and they're out on our table, and that might help you a bit. Why, now this is what I'm really excited about. Why can't the formulary listing be available to members to take to the provider?
It is available.
Guess
now.
what? As of 4 days ago, as of last week, after we got this question, I sent it to her, and it is on your portal now. Thank you, Mirza.
You're welcome.
Which one?
So you can,
suggestion?
on the Express Scripts member website that she demoed, there is a benefit and accounts notification and the formulary list that you can print off and take to your physician is now available to you. Thank you very much,
Welcome.
Mirza.
It was a great suggestion. Thanks
Thank
for
you.
bringing it up to our attention.
Okay, so the next one, I hesitate to bring up, but please don't throw anything at me. Will AFSPA consider the Silver Sneakers program? I think I get points for being brave enough to bring this up.
What is that?
The Silver Sneakers program is a wonderful program that is available for seniors at certain health clubs. It is fabulous, and I would love it. Unfortunately, the IRS does not agree with me. Actually, the IRS does agree with me, they just want to tax you on it. Here's the issue. According to medical and dental expenses that are tax deductible, and I will read you what it says, you cannot include membership dues in a gym, health club, or spa as medical expenses. So if we were to allow benefits for the Silver Sneakers program, you would have to claim that on your taxes.
Oh, wow.
I'm sorry, I mean, I couldn't make it up. However, we do, if you are interested, we do have discount programs that are available to you as part of your Foreign Service Benefit Plan brochure. It's in the brochure through Global Fit. You're paying for it, but they are discounted. My people out there will be happy to walk you through Global Fit. It's by zip code. There's a lot of gyms in the area here that are like well-known gyms that you can get a discount for being a Foreign Service Benefit Plan member. Just a few more. Okay, am I good on time? Okay. Oh, thank you. Thank you. I already talked about the HIPAA 3 form, so I won't get into that. Okay, the various health or lifestyle improvement products or services offered in connection with the core FSBP seem to be overlapping and duplicative. That's absolutely true. We have like 3 or 4 programs for diabetes. We have a couple different programs for blood pressure, all that stuff. And I looked at, and we look at this all the time. And the thing is, different strokes for different folks, right? Not one size fits all. And as long as I have even a handful, 1 or 2 members using like the virtual lifestyle management program, it is worth it to that member. So that is why we have several different opportunities, very flexible, so that, again, your health matters, and we want to provide you the individual benefits and services that will help you. So we will keep as many of those programs available to you as we can.
That was my question.
Yes.
Can I just ask you to take this one step further? The problem is, for the member, it's hard to navigate, hard to understand what's what.
Right.
And I'd like to be able to go to my primary health provider and say, not just about those, but here are the different things you have, and help me choose.
So, as a matter of fact, we have a chart, and it is on the website, and my people can show you, it is on the health programs, and the chart is by condition. So if you have high cholesterol, say, we can say, you know, okay, I have this condition, here are the programs that we offer you, and here's what they do. So I would refer you to the website, and that way you can take that, you can print it off, and take it to your physician, and discuss which one best works for you. Additionally, you know, you have great nurses that are available to you right out there. Well, right, actually, those 2 right there. Right there, because that's what we do. That's what they do, is that you just talk. And then they are able to refer you to the best program that might be suited for you. So you do have resources available, okay? Okay. I love it when Kyle's my boss. All right. Okay. The dental, the ancillary dental. I did not select dental due to because he didn't know that after order. But they have MetLife Dental, which is part of Federal Employees Dental and Vision Program. He wants to know if he can drop it and select one of ours. The answer to you, whoever you are, whether you're here or someplace around the world, is you can enroll in our dental programs at any time you want to, but you will have to wait until open season to drop your MetLife one for the dental and vision. And with that,
I have a question about that. Do you mean to sign on to the discount
you can sign on to
program?
our dental insurance programs or our discount programs
Oh,
at
you
any
have a
time. We
dental
have
insurance?
4 dental
Four.
insurance programs, actually.
And
For
we've got
us,
a
which is
representative from
different.
one of them here today to talk specifics, so we can talk about the others generally from one of our staff.
Can
All
you
right, so-
maybe post those that you didn't get to, or something related to?
Sure,
the
we can look at that, absolutely. So for now, do you want me to? Okay, so for those of you who are interested in Medicare and the Foreign Service Benefit Plan, I'm going to give a consolidated version of the class I give at FSI. For those of you who have heard it before, not interested, tired of hearing me talk, want some cake? Go on out there and start with the mini health fair, and the rest of us will join you when I'm done. Is that all right, Kyle?
Yep, we've got representatives from Livongo, Trestle Tree, which is a health coaching program, and this clinical team is here. Express Scripts from Merzad is here. We've got some folks from our team to talk to you about the wellness program and share those brochures with you. You'll also find a representative from Dominion Dental and from our ancillary insurance program. Thank you all very much for either tuning in or attending.
Medicare and the Foreign Service Benefit Plan, you know, I, for those of you who recently retired or have retired in the last 10 years, I guess, I give a Medicare talk at FSI. Yes, I gave one for 280.
Wow.
And this is, just seems to be the case. This is a shorter version, and it is specifically for the Foreign Service Benefit Plan. If you have another plan like Blue Cross or something, this doesn't apply to you. Sort of applies to you, but it's a little bit different. So, as you know, Medicare does not cover you any services that you receive outside the United States, only in very limited situations, like on cruise ships or something like that, okay? So the FSBP is primary for services you receive overseas, regardless of whether you have Medicare or not. That being said, then, you must file a claim with us. You don't have to go through Medicare. So if you have your overseas claim from your doctor or hospital, that when you were traveling, you need to file it with us, not with Medicare, because they won't pay for it. We'll know if it's a foreign claim. And then we will pay our normal benefits, which is 100% for inpatient hospital confinement, 90% for doctor's visits and things like that. And I also want to remind you that if you are traveling overseas and you have to go to a hospital, you may want to make sure that you know what hospitals we have a direct billing arrangement. It's very handy because they bill us directly. So you don't have to cough up those 10,000 euros. They just bill us. All right, so the list is on our website for overseas hospitals. We don't have them all. That doesn't mean that you have to go to those hospitals. You can go to any hospital you want to go to. All right, but if you go to one of those, you don't have to worry about it because you show them your Foreign Service Benefit Plan card, and they'll bill us, and we'll pay them. So it makes it very easy. Okay, so here's what I'm going to talk about. I'm going to talk about the 4 parts of Medicare, what happens with Medicare and the Foreign Service Benefit Plan, and what happens if you do not have Medicare Part B. You all have Medicare Part A, right? Did I have correct answers? Yes. All right, so Medicare Part A, you know, is for hospital services. This is for inpatient hospital care. That outpatient observation care. You know, you go into a hospital in the middle of the night because you've got severe pain. They hook you up to an IV. They may even put you in a room. You think you're inpatient, right? You're not. You are under observation care, and it's not covered under Medicare Part A. It is covered under Medicare Part B because it is considered outpatient. We have no choice in the matter. If it is coded as observation care, that's how we have to pay it. So,
emergency care?
no, it's not. No, it is not emergency care. It is called observation care. All right. So, and Medicare Part A covers hospice services and very limited inpatient skilled nursing facility. Very limited. That is all under Medicare Part A. Now the premium. If you do not qualify for premium free, which all of you do, the premium for 2019 is $437 a month, and there's a late enrollment period. You don't have to worry about that because you all have it free. The hospital deductible for this year from Medicare Part A is $1,364 for your first 60 days. If you are in the hospital on the 61st day, if you're that sick, then you're going to be charged $341 a day.
Wow.
Then if you are really sick and in the hospital for over 90 days, you go into your lifetime reserve, and that's going to cost you $682 a day. But lucky for you, you're a Fed, you got us, or one of the other FEA3 plans, and we pay for all that. So you don't have to worry about it. Skilled nursing facility, not so much. Even though that is covered under Part A, you know that only 20 days is covered. And it has to be skilled. It cannot be custodial. It cannot be intermediate. It has to be skilled. They have to be doing something for you. Therapy of some type, rehab, whatever. Okay? After the 20th day, you're going to be charged $170.50 per day. That's the co-payment for 2019. The Foreign Service Benefit Plan is one of the few plans in the federal program that does have skilled nursing facility benefits. But we only pay for 90 days and we coordinate with Medicare. Right, so we would pick up that $170 per day for 70 days, because the first 20 is paid at 100%. Right? If you get better in the nursing home, we are out of there, as is Medicare. If you go from skilled to intermediate or custodial care, neither Medicare nor the Foreign Service Benefit Plan nor any of the other federal health plans will pay a dime towards your nursing care. Right? If you are not inpatient in a hospital for 3 days prior to going to a nursing home, Medicare will not pay a dime. This is the scary thing about observation care. Okay, the cost is high, so that is why you need to know what the hospital is going to code it as, what they're going to bill the insurance company. All right? Because in order to get Medicare Part A nursing home benefits, you must be an inpatient in a hospital for 3 consecutive days immediately prior to your nursing home admission. You must be admitted to a Medicare-approved skilled nursing facility and receive skilled care. So what happens when you are on observation care, you are released to a nursing home, you have not met that 3-day inpatient requirement. Therefore, Medicare will not pay. So it's really important to know how the hospital is going to bill Medicare. If the hospital bills Medicare for observation care, it's covered under Part B. If you don't have Part B, we pay for it under medical, but that doesn't help you with skilled nursing. Don't ask me how you can avoid it, because I have to tell you you can't. Don't ask me, can't you pay it as inpatient, because it's illegal for us to pay it as inpatient if the hospital has coded it as outpatient. We can't do that either. On that happy news, let's talk about Medicare Part B. Medicare Part B is the medical part of Medicare. It covers your doctor's office visits, your lab tests, x-rays, outpatient hospital services, including that observation care I talked about. Limited home health care, you've got to be homebound. Durable medical equipment like hospital beds, wheelchairs, things like that are covered under Medicare Part B. Kidney dialysis, preventive and screenings, things like that. And a yearly wellness exam. Notice I didn't have annual physical there. I said wellness exam. Medicare Part B gives you 1 physical examination, and it's a welcome to Medicare when you first join Medicare Part B. Every year after that, they give you a wellness visit. That's where you go into the doctor's office and you complete that form that says, are you depressed? Do you have suicidal thoughts? How much do you walk a day? All of that. Doctor sits you down, talks to you about all of it. That is your wellness visit. There are no physical exams. There are no lab tests. There's no EKG. There's nothing like a physical exam. So who do you get to pay for your physical exam?
Yeah.
We'll pay for it. All right. So it's not a Medicare charge. It's your FEHB charge. We pay for it at our normal benefits. Meaning, for us, if you go to an in-network physician, we pay for that at 100%. All right. But Medicare does not. Premium on Medicare Part B is interesting. All right, so several years ago, they decided to save money, that the higher your income, the more they would charge you for Medicare Part B. So there's this whole formula that they use, and it's based on what your modified adjusted gross income is on your tax form from 2 years ago. And they go through this exercise every single year. for everybody who has Medicare Part B. It's an administrative nightmare. So, what that means is, for example, if you are an individual filing your taxes individually, okay, and your modified adjusted gross income is $108,000. Your Medicare Part B premium is not going to be $135.50 a month. It is going to be $270.90 a month. And that is per person. Medicare does not have a family plan. So you and your spouse, well, if you have a spouse, you'd probably be filing jointly. So the same really applies. Now, what they did last year is they didn't change a whole lot. I mean, they increased the monthly premium a bit. What they really did last year is they hit these two sections up pretty hard. The last two. It's almost $500 a month. Now, I don't know, financially, I'm supposed to say that only 2% of the population ever hits that. But most of you are right here. It just happens. You guys are smart and you've saved well and your income is high. But for, the normal person, who may have retired from Giant, it's not a problem. But it could be an issue for people, especially in foreign service, because you guys have saved well. Okay, Medicare Part B out-of-pocket costs. It's not as bad as Part A. It's $185 for your annual deductible, and then you have to pay 20% of what the Medicare approved amount is. Medicare pays 80%, you pay 20%. If you go to a different doctor called a non-participating doctor, you may have to pay an extra 15% because they can charge more. But let's talk about the different doctors, because there's 3 different types of doctors. You think there's tons of different doctors, right? There's not. There's 3 different types of doctors as far as Medicare is concerned. The first doctor is what we call participating doctors, physicians. We like these doctors. They play nice in the sandbox. They agree to bill Medicare for your services. They agree to not only be paid by Medicare, but to accept what Medicare says is the approved amount. Okay, I'm walking back and forth. I forgot I'm being taped, sorry. So they can't charge you any more than what Medicare approves. Medicare pays 80%. You are responsible for 20%, and we pay that 20%. So you're golden, right? It's not so bad. It's great, okay? The other type of doctor is what they call non-participating physicians, even though they do participate. Now, they will agree to treat you and bill Medicare, but they don't have to accept the Medicare approved amount. They can charge you more, but there's a limit to what they can charge you, thus the name limiting charge. Okay? So about 15% more. In this scenario, Medicare will only pay their original 80% off of their approved amount. Your health plan, depending on what health plan you have, is only required to pay that 20%. Now, the health plans can choose. We have the flexibility to decide if we want to pay that extra 15%. If you have the foreign service benefit plan, we pay that extra 15%. So, if you go to one of these non-participating physicians, you're golden also. Medicare pays, we pay, you're fine. Okay, we pay, this is why it's dangerous for me to have one of these things. All right, I have a chart. In this scenario, Medicare will pay, they approve 800, they're going to pay 640 for a Medicare participating provider. Your foreign service plan or your FEHB plan will pay the extra 20% and your liability is nothing. With a non-participating physician, one that does not accept assignment, the limiting charge may be a little more. Medicare is only going to pay what they usually pay, $640. If you have another federal health plan besides the Foreign Service Benefit Plan, they're only going to pay $160, so you may be liable for $120 of that charge. But if you have the Foreign Service Benefit Plan, we pay $120. We pay the $280.
160 and the 120.
Right, right. If you do not have the Foreign Service Benefit Plan, I would encourage you to make sure that you understand what your plan will pay. But it's not good or bad, and I'm certainly not criticizing the other federal health plans. We're not the only one that will pay that limiting charge.
And that's only if you
So,
have Medicare Part B?
That's only if you have Medicare Part B. I'll get to if you don't have Medicare Part B in a minute. Now, the third type of provider, they don't play nice in the sandbox. We don't like them so much. These are the ones, now this is if you have Medicare Part B. These are the ones that have completely opted out of the Medicare program. They absolutely refuse. They are called opt-out physicians. They make you sign a contract that you understand that they do not participate, that you are responsible for 100% of the bill. All right, 100%. They can't bill Medicare, you can't bill Medicare. But you have one of the federal health plans, Foreign Service Benefit Plan, or Blue Cross, or whatever. So you think you're good, right? No, you're not. Here's why. If you have Medicare Part B, your federal health plan under the FEHB program can only pay as much as we would have paid had you gone to a Medicare doctor. We are not allowed to pay any more, which means we can only pay that 20% of what we would have paid for a Medicare participating doctor. I have a chart. It's easier that way. So we talked about this if a provider accepts the assignment. We talked about if the provider is a non-participating provider and does not accept assignment. You're okay with those, right? This is what happens if you go to a private contract doctor. Same scenario, $1,000. We will know what Medicare approves because we run it through the Medicare system. Okay? Medicare won't pay anything. We can only pay the $160, which means you would be liable in this scenario for $840. Now, it's not good or bad, and this doctor may be an excellent physician. Understand that if you choose a doctor and he has you sign that contract, you have said you are going to pay that. And there is nothing we can do.
I have
Yes?
a question. What if the person doesn't take Medicare,
That's
but
coming.
it's a PPO?
That's coming.
Okay.
That's coming. This is only if you have Medicare Part B. All right? So if you are retired, over age 65, have Medicare Part A and B, and us, or another federal health plan, you're pretty safe, you know. Medicare pays, your federal health plan pays, you generally have no liability, and you get great drug coverage because your FEHB plan continues to pay for your prescription medications. So you don't have to buy Part D because you've got it with us or Blue Cross or whomever you have. How many of you have a plan other than the Foreign Service Benefit Plan here? Because I keep saying Blue Cross or whatever. Okay, you have some
Not
other
like
plan.
TRICARE.
Okay, but you don't have another, so I'll just keep saying Foreign Service Benefit Plan. Okay. You had a question?
I did on the totally opt-out doctors
Yes.
and the $1,000 charge.
Yes.
Is this where, you've talked about it, it always confuses me, that there is some limit on what they can...
Not there yet.
Not
Not there yet. This is
Isn't it-
Part B. This is if you have Part B.
Okay.
That's if you don't have Part B, and I'm coming
Okay,
to
I
that.
just couldn't remember which...
That's okay, patience.
Which
I
line?
got this. Okay. Medicare Part C. That's the third type of Medicare. It is a comprehensive. It's like the HMO for Medicare. Not popular with the feds. It's not popular with the feds because you have us, right? And you get to keep us. And the government continues to pay its part of your premium, right? Great to be a Fed. Really popular with private sector. Why is it popular with private sector? That's all they got, right? They retire over age 65. It's great to have one of these full service Medicare Advantage plans. Not too many Feds take this because they keep their federal health plan. Medicare Part D, that's the drug plan. It's the newest member of the Medicare family. It is means tested, meaning the higher your income, the more you're going to pay. For the Feds, I mean, I can go on and on about this, but for Feds, according to OPM, Feds don't have to buy this. Why don't they have to buy this? Because you have us, right? It's already in your plan, and whatever plan you have has creditable coverage, which means that our drug coverage is at least as good, if not better, as any Medicare Part D standard plan. So if you look on page 2 of any of the brochures, we're all alike, one happy family, it'll say federal retirees do not need to buy Medicare Part D because you've already got that in the policy you have under the FEA3 program. Now we're getting to what happens if you do not enroll in Medicare Part B. How many of you do not have Medicare Part B in this room? You better raise your hand, my husband. Okay, all right. So here's what happens if you choose not to take Medicare Part B. And you can't. Most of you have. Okay. By law, under the Federal Employees Health Benefits Act, we cannot pay any more than we would have paid had you gone to had you had Medicare. By law, the hospital and your physician, if that physician is a participating or non-participating, those first 2 columns there, if you go to one of those physicians, they cannot charge you any more than they would have charged you had you had Medicare Part B. They're both federal programs, all right? It's called the OBRA 93 Act, and I have the actual CFR in there so you know. But you would be responsible, as you are now, you're responsible for your deductibles, right? Your co-pays, your co-insurance, that's all there. Opt-out physicians, on the other hand, that third column of doctors, they don't have to follow this law because they don't participate in Medicare at all. This is where you're still protected, because just because they don't participate in Medicare does not mean that they don't participate with Aetna or with Blue Cross or with GEHA or any of them, all right? Most of them will participate, are in-network providers or preferred providers in your health plan. I mean, Aetna has 1 million providers in their network, right? So you are protected. Those discounts, those negotiated discounts still count for you. So you're okay, okay? But if you happen to go to an opt-out doctor, doesn't participate in Medicare, right? Doesn't participate in your health plan, isn't an in-network doctor, that doctor can charge whatever they want. And your health plan, meaning the Foreign Service Benefit Plan, is going to pay 70%, because they're out of network, right, of the plan allowance, not of what that doctor charges. The plan allowance, which is an accumulation of different claims and what his or her peers are charging. So you do run the risk of paying a lot more for those physicians. So If you're retired over age 65 and do not have Medicare Part B, yes.
But you could negotiate with the doctor, see.
Well, you could if you wanted to. Good luck with that. You want a job? No,
I
I'm
had
just
that, but you have the ability of bringing it up.
Yeah, I mean, you could negotiate.
Can't hurt to ask.
Yeah, I never heard that. Debbie, do you have a question?
I don't have too much experience with this as myself, but is there ever a disconnect between the doctor and the hospital as to who participates or doesn't participate? Where a doctor might be in network or participating, but the hospital has a set schedule for certain charges, and so you're kind of caught in the middle?
I'm not sure I understand the question.
Okay.
So
No,
maybe we'll
it
talk
doesn't make
offline.
sense. Okay, maybe it doesn't.
All right. It may, I just don't understand the scenario. All right, so if you are retired over age 65, do not have Medicare Part B, but has us, or one or the other, you have us, because you don't have any of those. Law requires that our payment is either the Medicare approved amount or the actual charge, whichever is lower. Which do you think is going to be lower? I have to put that down. Here it is. It's under Title V CFR 890905. It's under the Over 93 Act. So that is the one that says if you're under the FEHB program, they can only charge what they would have charged Medicare, period. Now, you will receive it on your explanation of benefits that says, under this act, you are only liable for this amount. Right? Most doctors here, they don't like it, but they will abide by it. If you have problems with that, then you call us, because we kind of know how to deal with them. All right? So, caution though, if the doctor's office talks you into signing that opt-out contract, even though they shouldn't because you don't have Medicare Part B, but you know, they can be pretty aggressive about that. If you have signed that contract that says you understand you're going to pay the whole amount, you're going to pay the whole amount. So be very careful what you sign, because we can't get you out of it because you just signed it. But for the most part, you do not have Medicare Part B. You go to one of those opt-out doctors, but he or she may not have opted out of us, just opted out of Medicare. You still have our discounts, you know. So, and if they are in-network doctor, you know, we're going to pay 90% and not 70%. Not a whole lot in the Medicare program has changed, except that opt-out thing. That was decided in 2017. We lost that one. I was saying, well, you know, I mean, they're not participating, so we should get that benefit. Not so much. But you do have the discounts available to you for in-network providers. Rule of thumb, it is always good to go to an in-network provider.
Yes.
Always good. You've got a million to choose from.
Yes.
Except when you're in the hospital and they give you a non-network person, not
So,
asking you.
let me address that, because we changed our benefit design this year, last year actually. So those are what the physicians you're talking about are what we call hairpin physicians. Not what we call it hairpin, not what we put in our hair. This is what they stand for. These are hospitalists, anesthesiologists, intensivists, radiologists, pathologists, emergency room doctors, and neonatologists. These physicians are running around the hospital, right? They come and say hi to you and charge you $150, right? Okay. They do not have a contract. They may work for the hospital, whatever, okay? But they don't have any incentive to sign on with a health plan. I mean, are you really going to fight with your anesthesiologist when you're about ready to go into surgery? Not me. All right. So OPM looked at this, and we've paid in-network benefits for these doctors for a decade. So if you had our plan, you've always gotten the 90% for these specific physicians. What we have done in 2019 is we've looked at the claim. Now, usually what happens if they try to overcharge you and you say you're not going to pay for it because whatever, because it's not fair or you've got, you've been paid enough, they usually will write it off. Believe me, believe it or not, they will usually write it off. If they don't write it off, then you need to contact us. We'll make it whole for you. We'll make it right for you. We won't pay 100%, but we will make it so that your liability is what you would have paid if those doctors were participating. So that plan allowance would go down, and we will take that on for you. Now, I can't speak for the other plans. We've just identified that that this is an issue. It's not your fault. It's not our fault either, because they won't negotiate it with us. But, we try to keep you out of the middle as much as we can.
Just to clarify, these hairpin doctors do not participate in what, like
And no, they won't participate in Aetna or Blue Cross, whatever. So even though you go to a hospital that is participating, right? But these doctors, there's no incentive for them. They're going to get you coming or going.
Okay, so they're independent.
Right.
Okay.
They're independent and they won't negotiate.
But when you encounter them, there's nothing.
There's nothing you can do when you encounter. No, they don't.
We're not in your plan.
Yeah, but so what I also recommend is, you have an entire case management staff out there that you can call before you go into the hospital. And they are able to look at these doctors. Because unless you're in an emergency situation, I mean, like we just had hip surgery, we knew that he was going in 2 months before he was going in. So we were able to look at, who are the anesthesiologists? No, we don't want this one, we want that one. So that stuff. And the nurses can help you with that. Our Aetna nurses can help you with that. That's what our case managers do. In emergency situation, you just want to feel better, right? So, and that is when we can help you on the back end.
Okay. In-network hospitals, for example, Nova Fairfax, if you go there, I don't know about them specifically, but they're in-network. Is it reasonable to say then that you run into these hairpin type doctors that, is that going to, in other words, is there some way to ensure, when you have an emergency situation, you can't do anything about it, you got to deal with it as it is.
Right.
But when you have a choice, like elective, then you go to a Nova, for example, and if they're in network, then is there a chance that you can avoid this phenomenon with the hairpin, or is that just
Not
their
so much.
fear?
Nope. You may think you're doing everything right. You've chosen the hospital that's in network. You've chosen the surgeon that's in network. You've chosen you have done everything right. And then the anesthesiologist comes to you an hour before they're ready to roll you in, and he says, trust me, you won't feel a thing. Are you going to fight with them over your bill? No, you're not. So this is how they get you.
Yeah.
And it has been a problem. For years, we've just paid it at 90%, understanding that you don't have an issue. But it's 90% of our plan allowance, not of what they charge. So we've worked out a way now that we can take it up a notch and make you not whole, because we don't pay 100%, but make you what you would have paid if they were in network.
How likely is it that you're going to walk into a hospital and you're going to have an anesthesiologist, and you're going to be able to choose all of these people who are going to be treating you?
If you plan beforehand, that's what our nurses can do. Yeah, you see, because you can talk to them and say, look, I'm going in for this, and I've chosen my hospital, I've chosen my surgeon, and they'll say, okay, well, let's talk about the anesthesiologist. Let's talk about what is going to happen to you when you get to the hospital, and do everything that they can in their power to mitigate your angst.
Isn't the hospital obligated, though? I mean, like in the case of an emergency, and you give them your, or someone on your behalf gives them your credit,
They don't have to pick.
They're not obligated to do anything. No, they're obligated to treat you and to bill you. That's for sure.
Okay, so it's a kind of crapshoot.
Yeah, it is.
In case of an emergency, okay.
Your resources here are OPM, Social Security, Medicare, and us, all right? Now, out there, you know Larry, everybody knows Larry Newfield. What am I saying? He's out there. He's our Medicare expert. He has they're putting it all together. That is our Medicare and the Foreign Service Benefit Plan. It covers everything I talked about. All right, take it, hold on to it, read it. It's really good night reading. If you have any questions, call our health benefits officers.
He's got it out there?
He's got it out there. He's got the actual brochures. Yes.
Paulo, if it's an emergency situation, so you go to one of the emergency hospitals around here, and ultimately you get the bells, and it turns out that you do have one or more of these hairpin services.
Right.
And you said ultimately you all pay up to 100%. Is that?
No, we pay up to 90%. Right.
Whatever.
Yeah.
But I get the bill, and that's how I find out that Mary Jones was non-participating.
Correct.
Is it your recommendation that we pay?
No, it's my recommendation that you call them and tell them this is ridiculous.
Right.
Right? You're a hairpin doctor. You should, you really should look at what you're charging. Usually they'll write it off. Actually, they really, believe me, they usually do. If they don't, then you call us.
Right. But in most cases, the hospital will have sent a number of the related bills to you, to Foreign Service Benefit Plan directly.
Right.
Possibly even that person. Then I guess we just call you.
Call us. Right. Thank you so much. I hope this information is helpful to you.